Alrighty, well, welcome back. As you can see, we have a special guest, Stefka Poweleit. She is the practice manager for addiction services here in Lafayette for Meridian Health. Thank you for joining us this midday.
Well, glad to be here.
Thank you. Well, we are talking about kids and mental health, and I think that everyone at home, including you, know that kids have had a rough year during this pandemic.
They definitely have. They've never had to be so isolated before. They've never been so unsure about what's going on in their world.
Yeah, and you and I were talking, not too long ago, and you had a perfect example that for kids, this is something that's really for anybody, but especially for kids because they, don't know how to handle it, and sometimes they don't feel comfortable talking about, mental health issues or something that they're dealing with that they don't understand.
Yes, so prior to COVID, we knew that there was always underlying depression, anxiety, suicide ideation with our youth, but it was always underground because it wasn't something they were comfortable talking about. But now that everybody is experiencing it, it's okay to talk about it now, so they're more likely to ask for help, but they really need to find supportive adults that they can do that from.
Absolutely. So in speaking of that, how is Meridian Health stepping in to kind of provide those resources?
So Meridian already provides children's services in Lafayette. We work with children and we can also work with their family together so that they can learn how to communicate and how to work on solving problems in a healthy way.
Now, has the pandemic really surfaced anything for Meridian Health? Maybe something that you didn't really know before that you now know?
Yes, one of the positive outcomes from the pandemic for Meridian is we've learned that the traditional way of providing services face-to-face, in person, doesn't have to be. We found that reaching out to a person for 15 minutes 4 times a week via the telephone really helps meet them where they're at. They're not overwhelmed. They feel like they can get help in the moment. So we do a lot more telephone interventions. We do it via Zoom. We can also do it face-to-face. We're now able to meet the patient where they're at instead of requiring them to come to meet us where we're at.
Which is really, really convenient. And since we're talking about kids, what are some tips for parents, guardians that, may notice something different about their child?
Yes, children are going to want to reach out to adults for help, but they're not going to reach out to them if they feel like they won't be heard, or if they'll be judged, or if they can't trust that that adult won't punish them. So make yourself available to be heard. Children also want to be taught what they can do differently. They are open to seeing how an adult effectively navigates conflict, and then they want to do that too. So be available, listen as much as you possibly can, and then offer them support when they need it.
Are we seeing any trends when we're talking about kids and mental health right now?
Yes, so isolation has dramatically impacted our youth. So they are looking forward to reconnecting again, but they're worried about reconnecting and overburdening the people that they're connecting with because they know everybody has struggled through this pandemic.
Thank you. Thank you, Stefka. This is Stefka Poweleit here with Meridian Health. Thanks for being here.
You're welcome.